There are 4 valves in the heart. The mitral valve is located on the left side of the heart, between the upper chamber, the left atrium, and the lower chamber, the left ventricle. The mitral valve opens and closes, keeping blood flowing in the right direction. There are 2 types of mitral valve disease. The most common type we treat is severe mitral regurgitation or a leaky valve. The second type is mitral stenosis, or a tightness or narrowing of the valve. There are other common conditions that sometimes accompany mitral valve disease. These include an irregular heart rhythm, known as atrial fibrillation, or a leaky tricuspid valve, known as tricuspid valve regurgitation. At Johns Hopkins, the patient can be assured that their surgeon is also an expert in treating these diseases. The most common treatment for severe mitral regurgitation is a mitral valve repair, which is considered the gold standard. At the consultation, the heart team will discuss what a mitral valve repair is, whether the patient's valve looks like it can be repaired, steps in planning for surgery, and what to expect from recovery. At the consultation, the patient will undergo a comprehensive multi-system history and physical exam by the heart team, the nurse practitioner and cardiac surgeon. The heart team will review the most recent cardiac imaging, including the echocardiogram or ultrasound of the heart. The echocardiogram demonstrates the reason of failure of the valve, the severity of the leak or tightness, and whether there are signs of heart damage. These would include a decrease in the heart function, increased chamber sizes of the heart, and whether there's increased pressure in the lungs. There are many details discussed at the consultation, therefore it is beneficial if the patient brings a friend or family member for support. Preoperative testing will need to be completed prior to surgery. Testing is patient-specific, but usually includes a coronary angiogram, which identifies if there are blockages in the blood vessels of the heart, and a CAT scan of the chest, which is a non-invasive study that evaluates the patient's lungs and aorta. Some patients may need a transesophageal echocardiogram, which is a special ultrasound that evaluates the heart and valves much closer. If a patient is not a surgical candidate, the heart team will determine if there are other less invasive options through clinical trials using the latest technology. Clinical trials do require further testing and a visit with our Johns Hopkins structural heart team. Johns Hopkins is a center of excellence, has a high-volume mitral valve program performing over 300 mitral valve operations per year, the most in the region. After the consultation, the heart team and nurse practitioner stay in close contact with the patient in scheduling testing, surgery, and are a source to answer any questions along the patient's heart journey. This can be an overwhelming and emotional time for a patient and family. We at Johns Hopkins are here to provide compassionate care and make this journey a smooth and pleasant process for each and every patient.